Andhra Pradesh is one of the prospering states in South India with close to 50 million population. It is the 10th most populous state in India with adequate health facilities established in urban areas and cities. Yet, there is a challenge to provide qualitative healthcare services in rural Andhra Pradesh. With more than 70% of the population in the state residing in the rural areas, there are a lot of shortfalls in the rural healthcare delivery due to the challenges in geographic spread, insufficient human health resources and limited infrastructure. To address the core problems of accessibility and availability of healthcare in rural areas, the government of Andhra Pradesh has come up with an innovative intervention of reaching the unreached through mobile medical units, MMUs, under its flagship program, Chandrana Sanchara Chikitsa, CSC. The government of Andhra Pradesh has launched 277 mobile medical units in the rural areas under a public-private partnership mode with
Piramal Swasthya
in April 2016. The objective of Chandrana Sanchara Chikitsa is to enhance health-seeking behavior and improve the well-being of rural people by providing qualitative primary healthcare services at the doorsteps of most vulnerable and difficult to reach areas in the state of Andhra Pradesh. Under this program, primary healthcare is provided to rural population in the entire state of Andhra Pradesh through 277 mobile medical units MMUs. Each MMU on an average visits 2 villages per day, thereby covering 13,523 villages across 13 districts of Andhra Pradesh on a fixed daily basis every month and covering a population of about 2.37 crore. Each MMU is staffed with a qualified MBBS medical officer, a nurse, a pharmacist, a laboratory technician and a driver. It is also equipped with a basic laboratory setup to perform preliminary investigations for diagnostic purposes including an ECG machine. The scope of services includes identification, screening, diagnosis, monitoring and treatment, follow-up and referral of high-risk cases in the areas of reproductive health, maternal health, neonatal health, child health, adolescent health, communicable and non-communicable diseases such as diabetes and hypertension. The program also includes checking of residual chlorine content in drinking water sources as it is a crucial determinant of health. Each MMU is also equipped with a laptop and 2 Android tablets loaded with special designed software which creates an electronic medical record EMR of each and every individual availing the services at the MMU. The data captured at the MMU can be tracked with real time on the Chief Minister's core dashboard which displays various reports on a public domain. The MMUs are also equipped with GPS device for tracking, biometric device for recording staff attendance, and a public addressing system for mass awareness campaigns. Once the MMUs reach the village, the MMU team conducts a transact walk and makes announcements of their arrival on the PA system. The ASHA and the Anganwadi workers of the village support the MMU team in mobilizing patients to the location where the camp is conducted. The MMU team arranges the camp in the form of different counters ranging from 1 to 4. Counter 1 is manned by the nurse who registers the beneficiaries and creates the electronic medical record and provides a unique ID for every beneficiary. Also, the nurse will capture some basic vitals such as height, weight, temperature and blood pressure. After capturing these vitals, the nurse refers the beneficiary to Counter 2, which is manned by a qualified MBBS medical officer. The medical officer does the diagnosis and treatment to the beneficiary and provides appropriate counseling and, as per the need, refers the beneficiary for laboratory tests at counter number 3, which is manned by the lab technician. The lab technician, as per the advice of the medical officer, conducts different types of tests such as random blood sugar, urine albumin, hemoglobin, AFB sputum, malaria, urine microscopy, urine pregnancy, etc. After completing the test, the lab technician will guide the patient back to the medical officer at counter number 2, who then, based on the test results, will decide on the medication which is dispensed free of cost by the pharmacist at counter number 4. In case of extreme and high-risk cases, the medical officer counsels the beneficiary and refers them to the nearest public health center for further higher treatment. Each MMU will have adequate stock of more than 50 different types of medicines ranging from antibiotics, anti-diabetic, anti-allergic, antifungal, antihypertensives, antiemetics, anti-epileptics, anti-helminthic, analgesics, antiseptic, vitamins and general drugs. Medicine sufficient for the entire month until the MMU comes back to the village for the next visit are dispensed by the pharmacist. ECG is done by the nurse and doctor for the beneficiaries above the age of 50 with complaints of chest pain or having comorbidity condition of severe diabetes and hypertension. The laboratory technician also conducts the chlorination test of water bodies such as overhead water tank, lakes, ponds which are present in the village. The chlorination report is shared with the Asha and the village Sarpanch, who in turn hand over it to the officials of the RWS department. Since April 2016, Chandrana Sanchara Chikitsa has created an impact in the lives of more than 8.8 million people in the state of Andhra Pradesh, especially to pregnant women and the old and elderly beneficiaries in the village who find it difficult to commute to the nearest government healthcare center. The visits by the mobile medical units have addressed their healthcare needs. A recent independent evaluation study taken up by Tata Institute of Social Sciences, Mumbai, has published that Chandrana Sanchara Chikitsa is an effective program with 92% beneficiary satisfaction levels and has financially reduced the out-of-pocket expenditure of the rural people of Andhra Pradesh drastically from 396 rupees to 80 rupees. With 277 MMUs covering 13,523 villages in 13 districts across the state of Andhra Pradesh, Chandrana Sanchara Chikitsa proves that it is high-impact solution at scale to address gap in healthcare delivery systems in rural areas. A solution which can create an impact and difference in the lives of millions.